And if I could follow up on my colleague's comments about what's happening in Georgia, I've talked to one of the largest home health care providers in Florida, and also we have a letter to the editor in the Sarasota Herald Tribune of November 16th, where this person who works for one of these home health care companies, the bigger ones, who aren't going to be in as much trouble, but they say, contrary to the other assertions that senior care will be unaffected by health care reform in Florida, this scenario could be devastating for older Floridians. More than 56% of Florida's home health agencies could be in the red as early as 2011. So we're going to take the smaller home health agencies, the mom and pops. By the way, in Florida, we have 1.9 million small businesses, and they're not going to be able to function because we're going to take this money out. And I want to make a point also, too. Today in the New York Times, the very good point was made. There's going to be no new insurance money coming in for home health care agencies, or very little. It's not like there are going to be folks that are coming in who are going to have this new public option or new insurance-backed program, because home health care is for seniors. There's not going to be any extra money. So what's going to happen? We're going to have our moms and dads, our grandparents who are benefiting from this home health care in Florida and all across this country. Instead of having to go to a nursing home, instead of having to go to an assisted living facility, away from their home, away from their family, and they're not going to be able to go anymore. And by the way, I don't believe that that's going to save any money. What I think that's really going to do is increase costs, because we know that nursing home care is far more expensive than home health care. It's estimated that one day of hospital costs, for example, is 43 times as much as home health care. So when you get rid of home health care, you're actually going to increase costs. And I want to just follow up on a comment, if I can, from my friend from New Hampshire, because I'm new here, and I'm still understanding the ways of Washington, D.C. But everybody in America needs to know that this bill is not going to help seniors at all. This bill takes money from senior health care. And if there was a legitimate and straightforward effort to actually help seniors, we would take Medicare savings and we would keep the money in Medicare. But as our leader said today, we're robbing the piggy bank. We're taking the money out of health care for seniors and we're putting it into this new program.
Let me also remind the senator from Montana that leaks all over this town. Sometimes good news, sometimes bad. But there was an article earlier this year where the senator from Montana's staff called in all these groups and their lobbyists, their high-paid lobbyists, and told them not to meet with Republicans. If they did, it would be treated as a hostile act. I'll be glad to provide that article for the record. I hope it's not true. I think it is. Senator from Utah.